This can lead to liver failure and death. There is a silent epidemic of this disease with no effective cure yet, and it is unfortunately on a rise. However, with the simple lifestyle changes that I will tell you about in this video, because I want everybody to know about them, you will be able to prevent the development or slow down the progression of the metabolic liver disease. Unfortunately, I'm seeing more and more young patients with diagnosis of fatty liver disease on ultrasound that's being done for whatever reason. In the hospital, I see more and more sick younger people in their 40s and 50s with advanced liver disease or liver cirrhosis, and all of them are shocked that they got it. It is very disturbing, but it could be prevented. 1 in 4 Canadians is affected by liver disease. Today, I wanted to talk about metabolic liver disease, the one that coexists with type 2 diabetes, insulin resistance, high blood pressure, heart disease, and other conditions. Some treatments exist and some are still in the work. There are things that you can do to prevent this from developing or slow down the progression if you have been told by a doctor that you have a fatty liver. And you don't need an expensive liver detox. Let's fire through some of the things that you can do to generally keep you well and healthy and will help to keep your liver well. Reduce sugar, refined carbohydrates, and ultra-processed foods. Try to eat more plants and more whole foods. Reduced alcohol. 0 is best. New Canadian guidelines recommend less than 2 drinks per week, and in Canada, an equivalent of 1 standard drink is 17.5 milliliters or 13.45 grams of pure alcohol. This is the equivalent of a bottle of beer, which is 12 ounces or 341 cc's of 5% alcohol, or a bottle of cider, 12 ounces, 341 milliliters of 5% alcohol, a glass of wine, 5 ounces, 142 milliliters of 12% alcohol, or a shot glass of spirits, 1.5 ounces, 43 milliliters of 40% alcohol. Increase your protein intake. Some sources say 30 grams of protein per meal. Some will say 0.8 to 2 grams per kilogram of your weight per day. And other sources will say about 30-35% of your calories should be coming from protein. Talk to your primary care provider. Increase fiber, preferably to 30 grams a day. Try to eat more plants. Generally, try to eat less and walk after every food intake. Increase exercise. Strength training 3 times a week would be ideal if your health permits. Another option is 8 to 10,000 steps a day. Remember, Canadian Cardiovascular Society recommends 150 minutes of exercise a week. That's at least moderate in intensity. Increase sleep to at least 8 hours per night. Exceptions apply. People are different. We all have individual needs. Just make sure you get a restful sleep that allows you to wake up in the morning without alarm, not relying on caffeine, and not staying too groggy for too long. So the amount of sleep that makes you well and happy. Look into vitamin D, magnesium glycinate, and omega-3 supplementation. And very importantly, spend time with your friends and family. Enjoy and foster those relationships. Consider all of the mentioned above interventions as your liver detox. Other things to consider and discuss with your doctor if you have metabolic liver disease or fatty liver changes in your liver would be intermittent fasting, 16 to 8 protocol, vitamin D and K2 supplementation, saunas 2 to 4 times a week, and others. Remember, prevention is the best medicine. The lifestyle choices you make will compound over days, weeks, months, and years, and will determine how well you will feel years from now. Your future self will thank you for the lifestyle habits you built today. Before implementing all of the above changes, talk to your doctor first. Subscribe to learn more tips on healthy lifestyle and disease prevention. Thank you so much for watching. May you be well. See you in the next video.